Today, black pastors from coast to coast, Los Angeles to Philadelphia, got together and wrote an open letter to the administration in Washington, D.C. They were calling on the Trump administration to demand that the COVID-19 deaths by race data be released to ensure that people of black and brown color, of all colors, actually get access to treatment. That group, which was headed by the Reverend Dr. William Barber, is called Repairers of the Breach, hosted a Zoom press conference today demanding immediate action. Here's a look at what they had to say.
There's a virus in the soul of America that calls for intensive and intentional treatment. As pastors who serve in communities that are most impacted by the coronavirus crisis, we have come together to issue a moral appeal to the conscience of a nation in a state of emergency. We appeal to you to channel treatment and resources to those areas in our body politic that have suffered the most from this national infection that has allowed this virus to spread disproportionately. As of this moment, black and brown people are being tested least, but dying the most.
Southern states with some of the highest black population have refused to expand Medicaid that would have provided health care, and they've done it with the permission and encouragement of the current Trump administration. When our Surgeon General Jerome Adams, with the approval of Trump and Pence, gave a national briefing, and he said in his comments that he had a special message for African Americans and Latino communities, calling them to step up and help stop the spread of the virus by avoiding alcohol, tobacco, and drugs. He was so wrong to do that. While he went on to change those things and talk about possible social ills, he never clarified them. As pastors from across the country, we know firsthand and have had to bear witness to the deaths of African Americans from COVID-19 and the heart-wrenching pain experienced by the families and communities left behind. It is for this reason that we stand with our communities, which for far too long have endured the structural racism and policy violence that is leading to alarming numbers of deaths in Black communities.
By establishing the Health Justice Advisory Committee, the PPC Poor People's Campaign is building an important bridge that allows researchers who are studying the health implications of racism and of social inequalities to contribute our expertise meaningfully to this urgent, community-driven progressive movement. Now, the disparities that are emerging reveal that the inequalities that have already existed in our society and that we have chosen to leave unaddressed are exacerbating the spread of COVID-19 in Black, Indigenous, and other people of color communities, and in socioeconomically marginalized communities.
What's going on when the virus of racism causes the hospitals and clinics to be taken out of Crenshaw and South Central? So we have limited testing for coronavirus, but no place to get care except one hospital. What's going on when we use sharecropper math is to make a policy for rent relief, which creates more of a debt burden for folks like my member Jamian, who's a veteran who's laid off of work and only got $1,200, which barely makes a dent in the rent.
I have seen the proliferation in Oakland, and our seniors and our homeless and our housing insecure people are in grave danger. There is no sheltering in place where there is no shelter. And the most vulnerable are people who are housing insecure. Something must be done. Something must be done.
I pastor cooks and cleaning staff and bus drivers and taxi drivers and hotel workers and grocery workers and mail carriers and shipping people and bus drivers who are trying to get food out to students who are now out of school in a neighborhood that is 85% free and reduced lunch. I pastor those people who are now seeking food for their children and for their families because those food services have had to be suspended because of the deaths of 2 bus drivers who died from COVID-19. I pastor a small congregation where approximately 80 people gather on a Sunday, and out of those 85 of those have tested positive for COVID-19. I have 2 funerals to do this week of people who died. Out of those 5, 3 of them had to go to the hospital 3 times before they were given a test. 3 times were they sent back home and into their families and into their communities being positive, but not being deemed worthy of a test. I pastor in a neighborhood where the federally qualified healthcare center begged for COVID testing, and before they could get it, the suburbs had already received their testing. And when they did receive their first shipment, they were given 5 tests. That in this nation of more than enough, that we are living under a Republican governor who thought it more important to be partisan with the president than to take action to save lives in St. Louis. So now we are sheltering in place. Now we have a mandate to shelter in place because now we are dying. But what happened to a nation of compassion where it didn't have to be you for you to act?
My congregation has experienced hospitalization and death of members due to the virus. In addition to that, I receive panic calls from congregants who work in hospital food service and nursing homes, where too many still lack protective gear to keep them safe. In Philadelphia, the numbers of infected persons are growing. Testing in more affluent, usually majority white neighborhoods outpaces testing in communities where persons already have fewer resources. We need a federal response that provides testing facilities in neighborhoods where poor people and Black people and brown people reside, protective gear to essential workers of every economic class, medical care and Medicaid expansion, data about race in testing and treatment, and an economic response that prioritizes poor people and the most vulnerable rather than corporations.
I feel we should, as a Black community, in addition to challenging, in addition to being the prophets of the nation, we must also do what our ancestors did during the days of slavery. According to E. Franklin Frazier, the Black church became a nation within a nation, and it provided emergency, quick assistance to our people.
We believe the 5 things that are there, if they were done and done immediately, would help in every area, from New Orleans to Philadelphia to St. John Parish to San Francisco to St. Louis. The issue is not, do we know what to do? The issue is doing what we know to do and to stop lying about it and being disingenuous about it and trying to act as though this virus is just going to go away, and to stop denying the structural racism. If in this moment, this virus points out the racism and the injustices and we address them, then we might be able to say there's a bit of a silver lining in the midst of this pain. We're going to either learn how to treat each other and make sure people have health care and what they need, or all of us will suffer irreparable damage from this pandemic.
The group has several demands, 5 of them in particular. Number 1, they want the Trump administration to use the Defense Production Act to produce personal protective equipment and to prevent price gouging. Number 2, they want the states and local officials to set up testing sites in field hospitals in Black communities. Number 3, they're calling on 14 different states to expand Medicaid and Medicaid access. Number 4, they want Congress to pass a 4th COVID-19 recovery bill, this one to focus on the communities of color and low wealth, ensuring paid sick leave, rent forgiveness, and a moratorium on utility disruption, as well as universal health care. And number 5, that the government release the race and the ethnicity of COVID-19 cases and deaths.